name is Aijaz Sofi and I am Assistant Professor of Gastroenterology at University of Toledo Medical Center. My co-authors on this study are Dr. Nawras and Mr. Waitley, who work at University of Toledo Medical Center, and Dr. Colin Howden and Dr. Ali Khan, who work at University of Tennessee at Memphis. We performed this study entitled Meta-Analysis of the Performance of Ultrathin versus Standard Colonoscope, which will be published in Endoscopy journal. As we know, one of the challenges with colonoscopy is the ability to reach cecal. The cecal intubation rate with the currently available conventional colonoscope is more than 95%. The other approximately 5% patients who have incomplete colonoscopy are usually managed by undergoing the imaging studies like double contrast barium enema or CT colonography. Alternatively, these patients may undergo repeat procedure under general anesthesia and maybe with the use of pediatric colonoscope or variable stiffness colonoscope. The downside with the imaging studies is high false positive rates with double contrast barium enema. Additionally, if we find a positive finding on imaging studies, these patients will ultimately require repeat colonoscopy, either for removal of polyps or obtaining biopsies from a lesion seen on the imaging studies. Alternatively, there have been some studies where thinner caliber endoscopes, which includes gastroscope, have been used in patients who had incomplete colonoscopy with a conventional colonoscope. Several studies found that use of thinner caliber endoscope is associated with improved cecal intubation rate in patients who previously had incomplete colonoscopy with a conventional colonoscope. Regarding the use of gastroscope, the downside with its use is higher rates of incomplete colonoscopy because of its shorter length. On the other hand, the newer ultrathin colonoscopes, which have the caliber similar to the gastroscope and the length is comparable to the conventional colonoscope. These newer ultrathin colonoscopes have been used in several studies to evaluate its efficacy in colonoscopy, and they have given uneven results. Therefore, in this meta-analysis, we decided to compare the performance of ultrathin colonoscope with the standard colonoscope. In this meta-analysis, we found that colonoscopy with ultrathin colonoscope is associated with improved cecal intubation rate and less abdominal pain compared with a conventional colonoscope. In addition, we also found that the use of sedating medications was lesser with the use of ultrathin colonoscope. Although none of the individual studies which we included in this review showed any advantage of ultrathin colonoscope over the conventional colonoscope with regards to the cecal intubation rate, but the results of the pooled data was favorable towards the ultrathin colonoscope. The likely explanation for the significant difference in cecal intubation rate between the ultrathin colonoscope and standard colonoscope in the pooled data could be the result of increased sample size, which will therefore reduce the sampling error. The results of the study are significant because lack of advantage of ultrathin colonoscope with regards to cecal intubation rate in individual studies was one of the reasons for lack of the enthusiasm of its use in colonoscopy. In this review, we also found that ultrathin colonoscope is associated with lesser requirements for sedation and analgesia compared to the conventional colonoscope. This is important because lesser use of sedating medications would minimize the potential cardiopulmonary risks associated with deep sedation and analgesia. The results of this study could have implications in deciding the future directions of colonoscopy. Lower risk of incomplete procedure with ultrathin colonoscope would translate into lower incidence of repeating the procedure and using imaging studies. In addition, lesser use of sedation and analgesia will decrease the recovery time after the procedure, which will increase the productivity of the endoscopic units, and it will also result in rapid turnover. Ultrathin colonoscope could be also an effective option in patients who are high risk for use of sedation and analgesia. In addition, ultrathin colonoscope has a potential to be used with other techniques like water exchange method, so that we are able to attain the goal of sedation-less colonoscopy. In future, we need large multicentric studies to compare a standard adult colonoscope with ultrathin colonoscope. The patient characteristics associated with incomplete colonoscopy with the use of ultrathin colonoscope needs to be studied in these future trials. In addition, more data is required to assess the difficulty of therapeutic procedures with ultrathin colonoscope compared to the standard colonoscope. In conclusion, compared to conventional colonoscope, ultrathin colonoscope is associated with higher cecal intubation rate, lower abdominal discomfort, and decreased requirement of sedation and analgesia. Thank you.